Hello everybody, my name is Nigat Saeed and I am a family nurse practitioner student at Franklin University. Today I am presenting a educational video with information on tick bite and Lyme's disease for my patients. I want to make sure that you understand how the tick bites and what you need to do to protect yourself and your family once you get the bite. Also, how can you reduce the number of bites by taking some preventive measures, and when to get the treatment once you get that bite. So let's begin. As we know that the tick usually comes out in early spring and summertime, like this time of the year, and most of the time they are not seen very clearly because they are very tiny. So it is important that you recognize them by looking and searching your body to see if you have been bitten by a tick. What are most of the areas that you would look for the tick? These are the most commoner areas, and I will share that with you. It's like on your hair, the scalp, in and around your ears, also under your arms, inside your belly button, also in between the legs, and behind your knees. So once you are either living in an area which is infested with ticks, or where ticks are more prevalent, if you are traveling to another area or location where they are more commoner, then you think that that bite from that insect could be from the tick. So if you suspect the tick, and if you plan to go outside to do your outdoor activities, then you will take some precautionary measures and protect yourself from getting bitten by the ticks. What do you do for that? Very simple measures. You can wear clothes, shirts that have long sleeves covering your body, long pants that you can tuck in your socks, and long boots, shoes, and you can wear a hat or gloves. That also protects you. Also, remember to stay away from thick, long bushes and grass. That's where most of the ticks they are there, and you get more chances of getting bit by the tick in those dense, thick areas. Those are some of the measures that you take. Now, other measures that you can take is you can also spray yourself with a bug spray that specially has DEET in it. That's important to remember, that the spray should contain DEET for the ticks. You also can wear some clothes which are already pre-sprayed by permethrin, which is pretty kind of safe when you use even in children and adults, and that is also one of the way to protect yourself. When the tick bites, they bite, they come on your skin surface, and they usually want to bite you on the skin. And once they go into the skin, they would like to suck the blood, where once they suck the blood, they usually have to attach themselves to your skin. And once they do that, then they can transmit the disease, which most commonly we are talking about today is Lyme's disease. They then multiply in numbers, and they grow and they spread in your body. That part, when it comes, then you might start showing some symptoms, and the symptoms usually are like sometimes like flu-like symptoms. You have fever, headaches, you can have soreness in your muscles, some joints, even swelling in the joints, and a typical rash. What we see is like a bullseye rash. It's a big rash on the skin, and if it starts spreading, it is the tick bite that has happened to you. So in order to and if you start seeing these symptoms, you should notify your healthcare provider and make a visit with them. But the most important thing that I want to talk about today is if you understand and know that you have been bitten by a tick and you see a black dot or a little piece of tissue that is attached to your skin, it is really important that you take this tick out as soon as possible. Now, how can you take this tick out from the skin? It's not it's easy and simple if you follow the instructions. You should use a tweezer, which is like pointed at the tips, and say for instance the tick is right here, and you will just pull this tick and grab it as close to the skin surface and grab it with the fattest part of the body, which is the body itself, and you just pull it gently and gradually, slowly, not making any twists, and just take it out. Now sometimes the mouthpiece of the tick can stay in your skin, which you don't have to worry about. It will fall eventually. Once you're done with that, you should either swipe your area for the site of the infection with the wipes, which is the alcohol wipes, or just wash them with plain soap and water. And also, once you grab the tick and you pull it out, you should put it in a sealed bag or a container that you can take it also to your healthcare provider to show them that you were bitten by a tick. That helps the provider to treat you. Now, what is the treatment actually for the tick, and if there is any special test that you do to see if you have a tick bite? The treatment is very simple, and initially you can have a short course of antibiotics once we test you, and you need to get that as early as possible. Especially children need to get this as soon as possible once we diagnose them with tick bite, which causes Lyme's disease. Adults can also get the same medications. For children or adults, you need to notify your doctor if you are allergic to any of those antibiotics, so we can make a proper recommendation and choose the right antibiotics for you. Are there any tests that tells you and your family members about if you got cured after getting the medications or antibiotics? I would say none so far. And even if you get tested and you test positive for Lyme's, and it might stay with you for a longer period of time, not just because you have the infection, but it's just because the body actually recognizes it and keeps it in its memory, saying that you had this infection before. So nothing to worry about. Once you get this treatment and everything else, you should watch for any more symptoms which might come in as a complication if it was not adequately treated, like some weakness of the face, more joint swellings, some heart problems like irregular beats and things like that, and some so you can notify your doctor and go and pay the visit, because it's important that you also monitor the bite symptoms as far as the complications are. What does this all mean? You get tick bites, can you not go outdoor? You cannot enjoy your life? That's not true. If you go outdoors, just follow the instructions and make sure that you protect yourself and try to get as much far away from the tick area where they are more prevalent, and just enjoy your activities. So thank you for watching this educational video, and if you have any questions, please bring them on, and we can discuss it more in the next visit. I hope you enjoyed it, and have a wonderful day, and keep doing your outdoor activities. My name is Nigat Sai, and I am a Franklin University student family nurse practitioner. Thank you. Have a great day. Bye.